Hello all, I am Dr. Walter from SNS College of Physiotherapy. So today we are going to see a case study video. Okay, so what is a case study video? So me and my mentees and my students are going to demonstrate certain techniques which are useful for the stroke rehabilitation patient. And this is Prasannas from third year, and this is Benjamin Thomas, and this is Rishivardhan. Okay, so now we are going for the case study video. So now we are going to see the stroke arm. Now we can consider this area and this area, that is the right side of the stroke. Okay, first of all, when we are going for an ICU visit to see a stroke patient, we need to handle the patient with the excess of care. Why? This arm and this leg will be in complete flaccid state. Okay, so you know what is complete flaccid state. Now how we need to handle this patient? Now we need to hold on to this hand, and first of all the basic technique is the traction. So all these area will be going for complete flaccid state. Look, so in this condition it will be going for wrist drop also. So first of all we need to go for the traction onto the initial stages. How? So what is the basic error which we are doing onto the physiotherapy style? We'll be going on like this. So this is completely false. Okay, so yes, we need to give the traction. How? We need to hold on to the area, and we need to hold on like this, and we need to go with the traction and the movement. Okay, so all these interphalangeal joints will be going for the traction and the passive movement. Okay, so this is about for one finger. So we need to do for all the four fingers and also for the thumb. Now we are going for the wrist area. How we need to give the wrist traction? So basically this area will be going for wrist drop. Look, it is going for wrist drop. So how we need to do? No, we need to hold on like this, and supporting hand onto the wrist area, and we need to hold like this, and we need to go for traction. So traction followed by the passive movement. Okay, so this is about the wrist flexion and extension. Now we are going for the elbow area. Okay, so we need to be very careful. Why? We started with the initial state of the interphalanges. Next, the wrist joint. Now we are entering into the greater joints, that is the elbow area. So how we need to give the traction? First, look on to my side. I am standing in the walk standing position, and I am going for the holding. Look, I am holding. Now I am going for the traction. So this traction is associated along with the shoulder also. So but we need to consider only the elbow. So how we need to hold? We need to hold on to the tricep area, go for the traction and the passive movement. Okay, now the last stage is the main area, that is the shoulder area. So shoulder, it will be going for many movements. Yes or no? We need to do all the movements for the stroke patients, but we need to be very careful about the shoulder pain syndrome. Okay, so what is shoulder pain syndrome? So drop your hands. So shoulder pain syndrome is simple. I'll explain. Shoulder pain syndrome, first the patient is going for what? Will be all these area muscles will be very loose. Okay, now flaccid things. So now if this area is going for the spasm according to the Brainstorms. You remember the brainstorm? Yes. So while stages are going, this shoulder will be going for the frozen like type. Understood? And that will develop the shoulder pain syndrome. It is very common, but in this condition, if this patient is having the shoulder pain syndrome, if I am doing the passive movement, look, walk standing position, passive movements, until this area, patient maintains a normal thing. And when I am going on to this area, the pain-free movement will be going for the pain-established movement. Okay, and also to this thing. So while giving this one, you need to come like this, hold on to this area, and you need to go for the abduction and the adduction. And this area nominal is 90 degree. And when we are crossing this 90 degree, the patient may feel the pain. And all these things will be considered as the shoulder pain syndrome. Okay, now the patient is going up from the normal things. We have done the passive movements, we have done strengthening exercises and also stretching exercises. Now The patient is going for the brainstorm stage 4. Brainstorm stage 4. Spasm will be reducing in this area and the normal movements will be developed. So it is our role to develop the movements. What kind of things can we give? PNF. So okay, PNF will be helpful. What are the PNF things? So D1 flexion, D2 flexion, do you remember? Yes. So how can we give? First of all, sit on to this area. So we can make the patient to sit like this, okay, and ask the patient to grab certain things, okay. For example, give your hand like this. So if we are having an area like this, so any object we can give here, we need to ask the patient to hold. So consider this as an object. You can consider my hand as an object. Now go on. You need to keep this object onto the above the neck level. How we are going to live? Onto that side, okay. Now clear. Now if you are raising any object from the top of the level, okay, from top till down, okay, demonstrate it. Go on with that thing. Keep your hand like this, hold objects and drop your hand down. Now look at his fingers. How his fingers are seen? It is like a semi-flexed, okay. In other words, we can say stages of the claw hand, okay. So it is our responsibility to remove all these contractures. Understood? Now drop your hands down. Go on for the lying. So today we saw about the upper limb stroke recovery from starting phase to the ending phase. So brainstorm recovery, upper limb stroke recovery, all these things we saw. Yes or no? So hope you guys have understood this case study video, and this is how we treat in our day-to-day life. Yes, thank you all for the cooperation, and thank you for acting as the stroke patient. Thank you.